I am Sida of Tokyo University in Japan. Today I would like to talk about current status contrast compute tomography examination for diagnosing acute pulmonary thromboembolism. Here is an introduction slide. Japan is one of the countries in the OECD that has the largest number of CT and MRI. As a result, excessive examination and high radiation exposure have become a problem. Choosing wisely is an attempt to curb unnecessary examinations and medical care by conducting appropriate examinations based on evidence. In the same way, American College of Emergency Physicians suggests this. Contrast-enhanced CT should be avoided in emergency patients with low pretest probability of pulmonary embolism and negative exclusion criteria determined for pulmonary embolism. This slide shows the diagnostic procedure for acute pulmonary embolism. Contrast CT should be performed when there is a circulatory failure or arrest, or there is a high pretest probability or high D-dimer value. We recommend that contrast-enhanced CT should be performed with reference to these results. This study aims to clarify the extent to which unnecessary examinations are used in the diagnosis of pulmonary embolism. This is a slide showing method. The time period and patient target look like this. Patients who underwent contrast-enhanced CT scan for suspected acute pulmonary embolism in the emergency room. These data items were extracted from the radiology information system. To determine whether a patient had pulmonary embolism or not, we extracted the disease name from the Diagnostic Imaging Report database. These data items were extracted from the specimen test database. But if the contrast-enhanced CT was started within 5 minutes from the date and time of the D-dimer test result, it was assumed that the contrast-enhanced CT was started without evaluating the D-dimer test value. These data items were extracted from the electronic medical record. This table shows the feature and score of Wells score. Total of 0 or 1 point is low, 2 point to 6 point is medium, and 7 point or more is high. This figure shows criteria determining that an examination is unnecessary in this study. No hypotension or no shock, and Wells score low or middle, and D-dimer no test or less than 1 microgram per milliliter, and not PE. This slide shows result. N equals 173 of these, 73 were men and 100 were women. Average age was 73 years old. The yellow field were unnecessary examinations. There were 27 cases. It was 15.6% of the total. This slide shows discussion. It is difficult to determine whether to perform contrast CT based on the Wells score result alone. The results of this study were consistent with the report that D-dimer has a high negative predictive value for PE. This study also suggested that CT scan is not necessary if D-dimer is negative. The period covered includes data from the Kumamoto earthquake in 2060. Contrast-enhanced CT in the emergency setting has been reported to reduce the number of missed PE. It is thought that There was an increase in the number of patients due to the disaster and that aggressive diagnosis was prioritized. This slide shows conclusion. Contrast-enhanced CT scan considered as necessary for diagnosis of acute pulmonary embolism was performed in 27 of 176 cases. That's all. Thank you very much for your attention.